To my good friend John McCain, you asked me how he's doing. He has called me 3 times this morning. No more woe is me, Lindsay. He is yelling at me to buck up. So I'm going to buck up. John is ready to come back, and I ask one thing of the good Lord. Just give him a chance for what time he's got left and I've got left to be relevant.
Senator Lindsey Graham there talking about his good friend John McCain. Of course, we all learned this week that Senator McCain is battling a brain tumor. We all wish him well. I want to talk more about all this now on our roundtable. Of course, the fact that Senator McCain is now getting treatment means he will not be back in Washington right away. Sara Fagen, one less vote for health care for Senator McConnell right there. Senator Schumer's gone from 50-50 to now thinking they're not going to pass it. Is there any way this can pass this week?
It looks unlikely, unfortunately, but I do think this is a once-in-a-generation opportunity for Republicans, and they need to come together and pass something, not only because it's right for the party and politically, and most importantly, right for the country. It's right for them at the ballot box. They don't even know what they're passing anymore. Does it just, well, just pass anything? This has been a debacle. It has been a debacle. And every corner of the Republican Party has blame here, from those that are on the far right, that are purists, to those that are on the left, that are fighting over small issues. We need to come together, or, ironically, Nancy Pelosi, who was ousted in 2010 as Speaker over health care, is going to be back as Speaker because of health care.
So how about this here? Versus this being good for the party, how would it actually
I said it's good for the country.
No, but actually it's not good for the country when you have 12 to 15% of Americans who say they only support this bill. It is a shameful bill. When I just sat here and listened to Senator Schumer talk about their plan, no, what your plan should be is going to those places, whether it is Mississippi, Alabama, Tennessee, West Virginia, saying, no, this bill was passed for you. When people support the Affordable Care Act but hate Obamacare, what they're actually saying is, we hate Obama, but we love the Affordable Care Act.
There's a lot good in this plan.
This bill is horrible, and what they should have done is sit with Democrats. You cannot change 1/6 of the economy and ignore the other parts.
Right now, the public's not buying.
The Democrats did change 1/6 of the economy. They
350 amendments from Republicans.
Here's the problem. President Trump was betrayed by House leadership and Senate leadership. Paul Ryan promised a bill that not only he could get passed through his chamber, one that Americans could get behind.
Hey, wait a second. Paul Ryan wanted to repeal and then wait a couple of years to come up with a replacement. It was the president who insisted on doing both.
No, well, listen, that is back on the table. Senator Rand Paul says, let's do the repeal only right now and replace down. Clean repeal. He doesn't have the votes. McConnell doesn't have the votes for some reason I can't understand. There are 3 senators, Portman, Murkowski, Capito, who are against this. Meanwhile, they voted in favor of this in 2015 to clean repeal, work to re-establish a health care plan. Why are they now against something that they were so in favor of a year and a half ago?
There's plenty of blame to go around among Republicans, but I think it's been lost that the original sin here, I think, was Mitch McConnell's. 9 years ago, he absolutely demonized Obamacare, the process, set the standard that no Republican can ever support anything short of repeal. And what is bedeviling Republicans right now, it did in the House, it did in the Senate, is that you can't square that circle. You can't take it away and survive.
It's that government shouldn't be involved in a private sector issue, which health care should be.
But not all Republicans agree on that. I want to bring this back to Maggie. You know, you talked a little bit to the president about this in the interview, but he has not been out front selling it. To the extent he's been there selling it, he appears at many times to have hurt the cause as much as he's helped it.
I think that, A, you have a divided White House. I don't think the White House is completely unified, and I do actually agree with you that I think there's a lot of fault here on the congressional leadership. But you don't have a White House that is in sync necessarily on this, number one, as to how much of a priority it is. You don't have a White House that feels like it has a chief of staff directing all the focus and resource on this, and that's just the reality. And then you have a president who is not a details-oriented person and doesn't fully, focus on some of the specifics the same way he does the top line. I also think one of the things he said to us in this interview, my colleague Michael Schmidt and Peter Baker and I, was he does believe, generally speaking, that people should be able to have health care just as a concept.
This is the fundamental problem. He promised health care for everyone. This bill does not give that.
Well, this bill gives money to states to solve the uninsured problem, and it also lowers premiums by 30%, which is
not repeal only.
Not repeal only. but the Senate bill does lower than 30%. Here's the fundamental thing, the reason that I think this is where it is today, is it's highly unusual for a sitting president in the first few months of his office to not be marching up legislation on the Hill and championing it, owning it, and having members of the Congress work with him to improve his or her legislation. President Trump has been kind of MIA on this. He tweets about it, but he doesn't have a plan.
No,
and as a result of it, you've got members of the party all over the place on this, and we can't come to consensus.
He has no plan because he knows nothing about it. Show me the
He has a lot of people who do know a lot about it.
He doesn't. Show me the times when he sat down with members and said we're going to have a public testimony. Show me the rallies. Show me the town halls. He is not working.
Paul Ryan put together a plan that his own house, the members of his own body weren't even allowed to see.
Here's the piece. You control the House,
members
the
of
Senate,
leadership
and the White House.
Put the health care plan together. The rest of the House couldn't see. Senators couldn't even see what the House was proposing. That's insanity.
Let me ask you a question. When Democrats control the House and the Senate, if the president sit on his butt in the White House and play golf, no. You know what he did? He actually went out and campaigned for it. He actually held rallies. He actually had a televised
You have to have something that's good enough to campaign for, Roland. You don't. This isn't good enough to campaign for. I think he should get out and campaign for a straight repeal, a clean repeal.
Josh.
McConnell asked Trump and his staff to back off on health care, to not get involved. You can't, I don't think you can go out and blame Trump for not getting the health care bill through the Senate if your majority leader explicitly told the White House back channel, don't do what you did in the House fight. Don't go threaten members. Back off. I got this. It turns out, it looks like McConnell
this is where something that Eric is right on, Maggie Haberman. You can't do something this big, this complicated, that affects so many people basically in secret.
No, I think that's correct, but I think that it has been in secret, to his point, on multiple fronts. I don't think you have seen anybody on the same page. The president got involved on the first go-around in the House. That didn't go so great. He backed off a bit after that. You have then had basically McConnell say, we're going to deal with this ourselves. There's no harmony among, so when we keep talking about how Republicans control Congress and control the White House, it's actually three different groups.
That's the last word. It's all we have time for. Thank you all very much.